Thank you all so much for having me. I'm going to wander up here. I'm too small to stand behind a podium. No one will be able to see me if I do. Thank you so much to Jimmy for inviting me here. I'm so honored to be here. This is the first time that our organization has spoken at this conference, and I'm thrilled. I have to tell you, I was a little nervous to go right after worship. Worship was so great. And I thought, oh my gosh, after worship, everyone's going to be so pumped and so excited, and then they're going to have to listen to me talk for an hour about the facts of poverty in Texas. So I hope you had your coffee. I hope you're sort of carrying that worship in your hearts right now and can sit through what I'm about to share today. But thank you so much for having me here. I want to start with sharing a little bit about the Center for Public Policy Priorities. As Jimmy demonstrated, it's the center with too many P's, sometimes we call it. It's extremely difficult to say. I'm not sure why we landed on that name. But I'll share a little bit of the history of CPPP with you also. So my talk is entitled Poverty in Texas, Who Belongs? And I hope that when we go through this presentation today, you'll start thinking about the communities that you try to create and who belongs in those communities and who we consider don't belong in those communities, and thinking about why that is and what we can do to change that. So I'll start a little bit with talking about the center. I think I did something wrong. There we go. All right, so I'm going to start by telling you a little bit about what we believe at the Center for Public Policy Priorities and our vision for the state of Texas. So first of all, we believe in a Texas that offers everyone the chance to compete and succeed in life. And our vision for the state of Texas is for Texas to be a place where everyone is healthy, well-educated, and financially secure. A state where everyone has their basic needs met. Now, currently, the Center for Public Policy Priorities, we're actually about a 20-minute walk west. Our offices are not too far from here. The center has around 20 staff. The organization has been around for around 30 years. But I want to tell you about how the Center for Public Policy Priorities got started. The organization started probably not too far from where you all are working today. The organization was started in Boerne, Texas, a small town a little west of here, by a small group of Benedictine sisters who were motivated by their faith to work on healthcare needs and healthcare access for the poor in their community. So their organization actually started as a small faith-based organization. And what happened was the sisters were working on healthcare for the poor in their community. They realized that the need was just so much greater than what they could work on by themselves. And many of you are probably finding yourselves in the same situation. Jimmy mentioned earlier that we really need to connect with each other and start thinking about how we can work together. So the sisters realized the need was bigger than they could tackle on their own, that their organization could tackle on their own, and they started to think about how public policy was affecting not only the needs that they saw in their community, but potentially some of the solutions that could address it. So about 30 years ago, they started a policy organization that focused on healthcare access, and it was called the Benedictine Resource Center at that time. And currently, we're an independent public policy organization and have since expanded to include other policy issues like education, financial security issues, along with healthcare. I bring up this story, as I said, because I think that the sisters were very pragmatic and very wise in thinking about having a bigger vision for what they could contribute as individuals and what their organization could contribute, what their talents were best suited for, but also thinking larger about how they could work with other organizations, work with public policies to address the needs that they were seeing. And now you all know that the best part of a conference is not listening to people like me talk, but activating all of the knowledge in the room here and talking with each other. So I really hope that you get a chance to talk to each other in different communities who are coming from all over the state, can connect with each other, because I really believe that by connecting organizations to public policies, we can really amplify our effect. So I'm going to start with a little disclaimer. I am a nerd, I'm a data nerd. Jimmy said that I was going to be sharing the facts with you today, and I will be sharing a lot of data with you. Don't be scared. I hope you've all had your coffee. But I just want to remind you that all of the data that I'm going to be presenting, behind all of that data are the faces and stories of families in Texas. Whether or not a family can go see a doctor if someone is feeling sick, whether or not a kid is going to graduate from high school, or whether a family can just make ends meet and pay their bills every month. Those are the stories behind the data points. So keep that in mind. The other thing that I like about data is that it gives you perspective. Jimmy mentioned that there are people from all over the state here. I've had a chance in the course of my work at the center to be able to travel to a lot of different communities in Texas. And there's a lot going on in the state. It is a really big state. And it's difficult for people in Austin or Waco or McAllen to know what's going on in each other's communities. So data is a good way to get a little bit of a perspective on what's going on in different cities around Texas, what the common needs are, where the gaps are. And so that's my plug for data. I'm going to convert you all at the end of the room to be data nerds just like me. Pretty soon you'll be pulling down census data and manipulating spreadsheets. So that's my plug for data before we get started. One last thing, you'll notice that in the middle of your tables, you have these truth or dare cards. These are a fun tool that we use in our office to keep us motivated. The way we use them, how many of you ever played truth or dare when you were kids? I'm sure we all have. I'm sure there's some good stories behind those too. So the way we use these truth or dare cards in our office, and if you visited, you'd see them sort of posted in people's offices or on the walls, is that we'll write either underlying truths or facts that motivate our work. So that might be a statistic about poverty. It might be knowing that, as Jimmy said, that mental health care access is particularly difficult for many Texans. And then the dare is the goal that we are setting for ourselves, for the organization, or for the state of Texas. So during this presentation, if there's anything that you feel moved to write down as a truth that really resonates with you, or a dare that you'd like to set for yourself or the organization that you're here representing, feel free to write that down. I love to see those after presentations. It's really fun to always see what people have come up with. So that's there for you and to just keep you engaged. So I'll start with a very simple example. Truth, 1 in 12 Americans lives in Texas. Texas has 26 million people in it. What happens here affects not only the people of the state, but it really affects the trajectory of the whole country. Not only that, Texas is at the leading edge of a demographic shift that we're seeing in many other parts of the country. We're a very diverse state. We're a relatively young state. We're a state with a lot of immigrants. So when you look at what's happening in Texas, in many ways, we're looking at the future of what's happening not only in our state, but in our country. At the same time, Texas is at the bottom of some key measures of well-being. And so our dare for Texas is, we dare Texas to be the best state for hardworking people and their families. This is something that we say at the center all the time, and it's something that I think really motivates all of our work. That we dare Texas to be the best state for hardworking people and their families. So in my presentation today, I'm gonna start with going over some of the needs. Again, this is the No Need Among You conference, and we'll start with looking at some of the needs in some key areas, and then we'll talk about some of the policy solutions that my organization has been working on. We're gonna look at the need in 3 key areas. Our vision for Texas is a state where everyone is healthy, well-educated, and financially secure, so we'll look in those 3 areas and then go into some of the policy solutions. Now, the first area is health. And health and well-being is a multifaceted area. When we talk about health, we're talking about mental health, we're talking about affordable access to health insurance, we're talking about nutrition and hunger. There are a lot of different aspects to well-being and health in our communities. Don't have time to go into all of those today, so today I'll be focusing on just 2 key pieces. The first is access to health insurance in our state, which is a key need that we see. And the second is food and nutrition, and the extent of hunger that it currently exists in Texas today. So this past year, Texas recently became the state with both the highest uninsured rate and the largest number of uninsured people. Prior to that, Texas had been the state with the highest uninsured rate, but we were not the state with the largest number of uninsured people. That was the state of California, which is as large as Texas is actually larger in terms of population. But this year we have moved into the bottom in both of those categories. However, Texas has improved dramatically. In 1 year, we saw the uninsured rate drop 3 percentage points, which is a huge gain for many Texans. But the problem is just that Texas was starting a little further behind, and other states have been improving as well. Part of the reason that we have, for the child uninsured rate also, we've seen the numbers improve dramatically. Over the past several years, we've seen the child uninsured rate drop from 18 to 11%, although again, that still puts our child uninsured rate near the bottom among the states. Part of the reason that we have so many uninsured Texans in the state is because of something called the coverage gap. Now, what is the coverage gap? Let's compare 2 different families, one who is not in the gap and one who is in the coverage gap. Now, the first family is a family of 4, earns $24,500 a year. That income puts them just above the poverty line. In this family, the parents earn too much to be eligible for Medicaid, but they do earn enough to be able to access private subsidies in the health insurance marketplace. So if they were to shop around on healthcare.gov, they would find that a typical plan for them might cost around $43 a month, or 2% of their income. They may decide to purchase that health insurance, and in the process, they've learned that their children were eligible for Medicaid and covered their children through the state Medicaid program. Now, let's look at a second family. Perhaps it's just a family who lives across the street. This family in Texas earns $23,500 a year. They earn just $1,000 less than that first family. Their income is just below the poverty line. They're a working poor family in Texas. Currently, the way the policy is set, the parents still earn too much to be eligible for Medicaid, but they also earn too little to be able to access the subsidies that would help them purchase private health insurance through the marketplace. That means if they went on to the health insurance marketplace website, they could shop around and they would find that their health care premiums would cost around $440 a month, which for this family would be over 20% of their income. That's not affordable for that family. Most likely they would choose to remain uninsured. And although the children are eligible for Medicaid, we find that a majority of the kids who are uninsured in Texas are eligible for CHIP or for Medicaid, but live in families like these who are completely disconnected from health insurance. Many of these low-income families that we see have very low health insurance literacy. Health insurance is a complicated product. They're not sure or knowledgeable about what they're eligible for, how to access health insurance, how to use it. And we've seen in the past that through past research and other times when health insurance rates for adults have gone up, that the more likely that if parents are insured, the more likely it is that children are insured as well. So having parents connected to health insurance is a key piece for child health in particular. Now, another way to envision the coverage gap is through this income scale. You'll see at the top of the income scale in that yellow, those are all the families that earn above, live above the poverty line and are able to access the subsidies to purchase health insurance. But there are 1 million Texans who fall into that coverage gap, that red area of the income scale, that are living in poverty but aren't able to access any affordable health insurance options. Now you'll notice at the bottom of that income scale, Medicaid is available for very few parents in Texas. The current policy that the state has set, a parent must earn less than $4,367 a year to be able to be covered through Medicaid. So we are leaving a lot of Texans with basically no options for health insurance in this state. Health insurance is a key piece of how we access quality health care and mental health care in the United States. And one of the biggest needs that we see in Texas, and a solvable problem, is the policy gaps that we see around the coverage gap. Now I'm going to shift gears a little bit to talk about another building block of health in Texas, which is nutrition. We all know that an apple a day keeps the doctor away, that good nutrition is a key building block of good health. Many of you have probably seen in your work, in your churches or in your communities, that hunger is also a need in a lot of our cities and rural areas. And food insecurity, sort of the fancy term for hunger, food insecurity is a symptom of financial insecurity in Texas. It's what happens when families just don't make enough every month to be able to consistently purchase food for their families. They start by paying their rent. That takes a big chunk of their paycheck. They need to pay for gas for their car. And then the calculations start getting a little iffy around childcare, around prescription medications, whose cost is often very expensive for families. And food is often a thing that gets squeezed or that gets bought when it can, but isn't consistently there for a lot of families in Texas. Now, the U.S. Department of Agriculture actually interviews families every year to try to get a sense of the extent of hunger and food insecurity throughout our country. And some of the statements that families agree with when being interviewed about their access to food during the day and throughout the month are up on the board here. I don't know if you can read them, so I'll read them out loud. We worried that our food would run out before we got money to buy more. We couldn't afford to eat balanced meals. We skipped meals because there wasn't enough money for food. These are the types of situations that very many Texans are living with. In fact, 4.7 million Texans struggle with food insecurity in our state, including 1.9 million children. That's one of the highest rates of food insecurity that we see in our country. So food insecurity and hunger is also a big need that we see relating to the health of and well-being of our communities. Our vision for Texas includes not only that communities are healthy, but also that they're educated. And we know that these things are connected. When we look at investments in education, we see that not only do more educated people and more educated kids have better educational outcomes, better test scores, graduating from high school, graduating from college, but that it affects their outcomes in many other areas, including health. And we actually did a study a couple years ago looking at state investments into these areas to see what were some of those cross effects. And what we found is that when the state invested more in education, not only were kids' educational outcomes better, but their health outcomes were better. We saw better outcomes in safety, such as a lower rate of child and teen deaths, infant mortality rates. And we also saw connections to positive youth behavior, such as lower juvenile crime, lower teen birth rates. We know that education is one of the keys to unlocking opportunity for young people in our state. We also know that investing early matters. Over the past legislative session, there was a lot of energy around providing better access to high-quality early education for our kids. And there was a lot of effort behind that, and the governor made that one of his priorities for the session because there has just been decades of research that shows what an impact high-quality early learning opportunities can have for our kids, and the benefits go throughout life. Kids who have access to high-quality learning when they're young are less likely to be held back in school, they're more likely to graduate, they have less contact with the juvenile justice system. When they're adults, they have less contact with the adult criminal justice system. The list goes on what having a good start can really do for our kids. This is one of my favorite quotes. I think it sums up all of that research really well, which says that it's easier to build strong children than it is to repair broken men. Investing early really matters. But one of the big needs that we see in our state right now is around the way our system funds schools. Now, you may have heard of the school finance lawsuit that's going on right now. A little background on the school finance lawsuit. There are a little over 1,000 school districts in Texas. About 600 of them are currently suing the state over the way that the state funds schools. And their claim is that the funding is not adequate to meet the needs that exist, or for the schools to be able to meet the standards that the state has set for them, and that the funding is not equitable the way that it currently is set up. This is a quote from the district court judge who ruled in the case after he reviewed the facts. And he said that Texas's future depends heavily on whether it meets its constitutional obligation to provide a general diffusion of knowledge. And what that means is that Texas's future prosperity as a state depends on how well we educate our kids. We all know this. Investing in education matters not only for kids and for their opportunities, it matters for a strong workforce. It matters for what the future of our state is going to look like. Unfortunately, he said, Texas has defaulted on that promise to our kids. The state Supreme Court is currently reviewing the case and will be making a ruling in the spring. But what are the issues in the case? Well, there are two main issues. One is of adequacy and the other is equity. Adequacy is about whether or not the state funding system is currently set up to meet the needs of a rapidly growing state. We know that Texas is growing. Growth is good. I'm glad the state is growing, although it can cause some problems on I-35 sometimes. And we see that every year, student enrollment, it keeps going up and up. But we also see our funding has not kept up with our student growth. The red line here represents sort of the average amount of funding that the school finance system currently generates per student. That spike in the middle is an infusion of federal dollars that was given to the state as part of the stimulus package during the recession. But we see since then that the funding per student hasn't really kept up with the growth that we've seen. So adequacy of funding is one of the issues in the case and why 600 school districts have come together to tell the state, hey, there's a lot of need out there, and we currently need more resources. You keep raising the standards, and we need more resources to help our teachers and help our kids meet those standards. The second issue is one of equity. There are a couple different issues in the equity part of the argument in the school finance case. One is around taxing equity, which is a very important part of the case. By and large, we see that poorer neighborhoods are actually having to have higher tax rates in order to generate the same amount of money to keep to pay their teachers well, to keep their schools going, than wealthier districts who can have a lower tax rate to meet those same needs. Another key piece of equity is around the opportunity to learn. We know that kids come into the world with all different strengths and all different needs. I like this picture because it shows, I think, a good picture, a visual of the difference between equality and equity. And you ask any teacher what they try to do in the classroom, and they know that each of their kids is an individual, and in order to meet the needs of that individual student, sometimes you have to do things a little differently. So one of the key pieces of the school finance lawsuit is also around the equity of funding and whether or not the school finance system currently acknowledges the different needs that we have in our huge and diverse state. And it really is a very large and very diverse state. I just have a few different stats here. Our Texas school population is around 18% in bilingual or ESL classrooms. We have 60% of our kids on free and reduced lunch, 9% needing special education services of some kind. We have a very racially, ethnically diverse student body, majority Hispanic, 28% non-Hispanic white, 13% African American, 4% Asian, which is fast growing. And in Houston ISD, so during grad school, I actually did my summer internship at Houston ISD. Are there any people from Houston here? Whoa, there's a lot of Houston people. That's great. I love Houston. I loved being there for the summer. Although I saw my life flash before my eyes every time I got on the highway. Y'all are very aggressive drivers. But Houston ISD, when I was working at the district, Houston is one of the largest school districts in the country. And over 100 languages are spoken just in the Houston ISD school district. I don't know if many people know that. I can't even imagine 100 languages. We have an incredibly diverse state, incredibly diverse student body, but it's our responsibility, and it's the school's responsibility and obligation to educate all the kids that we have here for not only their futures, but the prosperity of our state in the future. So school funding is a big policy need that we are looking at currently. And the truth is that we are not tapping the potential of so many of our students. This is some data from the Texas Higher Education Coordinating Board. We like to call it the leaky education pipeline. And what this study did was looked at 8th graders and tracked them for 11 years to see what happened to all the 8th graders in Texas public schools. And we found that the study found that starting with 100% of 8th graders, 69% of them graduated high school, then 53% enrolled in higher ed, and then by the time all those 8th graders were about 25 years old, only 20% of them had completed a higher education credential of some kind, a 2-year degree, a 4-year degree, a certificate. We're leaving a lot of talent untapped in this state. When we look at low-income students, we see bigger gaps. Around 60% will graduate from high school, 40% were enrolled, and by the time they were 25, only 10% of those original 8th graders had completed a 2- or 4-year degree or other type of higher ed training or credential. And let's remember that 60% of our current student body is what we would consider low income. So we are leaving a lot of talent untapped in our school system, and the school, this is a huge need that we see. We've seen a lot of improvements, especially in the high school completion. Sort of the next phase of that is how can we get kids not only into but through college? Because we know that the jobs of the future really require that higher ed degree. So that's some of the needs that we see in education. And the last part that I want to talk about is poverty and economic security. But we've really been talking about poverty this whole time. We know that poverty affects how well kids can do in school. We know that poverty affects kids' health outcomes. But we also know that having good health, having access to a good education, those are the building blocks that help people get out of poverty. Those are the key pieces that need to be in place. So when we talk about poverty, there's sort of a technical definition, and then there's maybe a picture that comes to mind, or sort of a feeling that we have when we think about poverty. I'm going to start with talking about some of the technical aspects of poverty measurement. And then I want to share some stories of a few families in different parts of Texas and the struggles they have from day to day. So first, the technical definition of poverty. There is a hardline income cutoff for who is considered poor in the United States. The number differs based on how big your family is, how many kids you have, things like that. But just as an example, for a family of 4, in order to be considered poor or living in poverty, you have to make under $24,000 a year. That means if you make $25,000 a year, you're not considered to be living in poverty, you're not captured in those poverty statistics. It's a pretty low income threshold. It's one of the seminary students asked me earlier this week about the history of the poverty measurement, and it was actually developed in the 1960s. It's been updated for inflation since then, but hasn't really been changed since then. When we look at that official level of poverty, 1 in 4 Texas kids lives under that income threshold. child poverty is a huge need in our state. And it's a problem that exists all throughout Texas. There is no community, county, region in Texas that is untouched when it comes to poverty or child poverty in particular. Even in the most affluent communities and counties in the state, we see child poverty. Rockwall County, which has one of the lowest rates of child poverty in Texas, 1 in 10 or 1 in 11 kids are still living under that very low income threshold. And the truth is, we know that there are a lot of families who are not officially living in poverty, but who struggle. A lot of families who are struggling to make ends meet day to day. And if you ask people, how much money does it take to just sort of get by, not live an extravagant lifestyle, just pay your bills, get food on the table, make rent. The number that people land on is usually around twice the poverty level. So I'd say for a family of 4, around $48,000 a year. Does that feel like a little bit more reasonable to you, I guess, in terms of sort of what it takes to get by? And we wanted to see how much money it would take to get by in different communities. And so the Center for Public Policy Priorities worked on a project called the Family Budget Calculator, where we looked at all the different metro areas in Texas and said, okay, how much does rent cost in this area? How much does food cost? How much does childcare cost? And sort of built a family budget from the ground up to see how much it would take to get by. And most of the time it came out to around that level, around twice that poverty level, what people sort of intuitively knew just from their day-to-day experience. This is just an example from our family budgets calculator in Waco. Comes out to around a little under twice the poverty level for what we see for a family to be making ends meet. And when we look at that level, so how many Texans live under twice the poverty level? We see about 38% of Texans live under that income threshold. There are a lot of gaps when you dig into the poverty data. We see big gaps by race, ethnicity in Texas. People of color in Texas are more likely to live in poverty. Women are more likely to live in poverty than men in Texas. Children are much more likely to live in poverty than adults or people who are age 65 and over. So when you dig into the data, you see all sorts of patterns and disparities. And I just want to present a couple of these differences to you today that I thought would be interesting and pertinent. And the first has to do with family structure. Now, when we look at families with children in Texas, 20% of families with children are considered to be living in poverty. Two-parent families, only 11% live in poverty. 22% of single dad families live in poverty, and over 40% of single mom families live in poverty in Texas. So that is one of the key gaps that we see. Another is strongly related to education, to tie back to how important it is that we make sure that our kids are getting a good education. People with a bachelor's degree are far less likely to live in poverty than someone who has dropped out of high school. Education is one of those key factors that affects poverty rates in Texas. So making sure that kids get the degree, or that adults who haven't finished their degree have pathways to be able to get back into education and training is a key piece of protecting individuals and families against poverty. And if you take away one thing that I'm going to talk about around poverty in Texas, it's that when you look at poverty in Texas, what we see in the data is that poverty in Texas is largely not about the availability or access to jobs. It's a problem of low wages. And this is This statistic, I think, illustrates that well. When we look at the unemployment rate for parents in Texas, it's 4%. That's lower than the national average. But our child poverty rate is 25%. That's higher than the national average. When we look at other states, the data usually shows that higher unemployment rates are connected with higher poverty rates. Sort of intuitively makes sense. But in Texas, that connection is not as strong. We have an abundance of jobs. The problem is that many of those jobs don't pay enough for families to be able to make ends meet. The problem of poverty in Texas is very largely a problem of working poor families in our communities. In fact, when we look at the lowest paying jobs, Texas is ranked 7th highest in the share of minimum wage jobs that we have in our state. So it's not the availability of jobs and the job growth that's a problem, it's the low wages that are attached to those jobs. And the last point I just want to make about poverty is that poverty is not just about income that families are making day to day. Poverty is also about, well, not poverty, financial security or financial stability is also largely about the ability for families to be able to save and have a little bit of cushion so that when something happens, when someone gets into a car accident, someone gets sick, or your car breaks down, all of those things that happen in life, that a family is able to weather those emergencies without completely falling into catastrophe. It's also about the ability for families to save, to invest in the future, and invest in those things that they want for themselves. That might be saving for a house, saving for a college education. And when we look at that sort of higher standard of financial security, of whether or not a family is able to protect themselves from something unexpected that happens, or be able to save for the future, we see that half of the households in Texas are what we would consider liquid asset poor, meaning they don't have that cushion for themselves and are just sort of making it and hoping that nothing bad happens. So I've shared some data with you around poverty and some of the technical definitions around poverty. And I wanted to move to sharing a short video with you. The video is around 6 minutes long. It's part of a larger documentary that the Center for Public Policy Priorities produced a few years ago with some of our partners, probably organizations that are very similar to your own, throughout the state of Texas, to interview families to talk about just what they were dealing with on a day-to-day basis. So I thought it might be helpful to sort of bring it back from all the data and facts to what poverty really looks like in the stories of people throughout Texas. So I'll go to the video now. Those are the stories of some of the families in Texas and the need that we're talking about. And I'm guessing some of that is not unfamiliar to you in what you see in your cities. So now I want to talk a little bit about some of the policy solutions that the Center for Public Policy Priorities is working on at the moment. I'm going to use this Truth or Dare tool that I mentioned earlier and frame it around the big dares that we have for our state. And I think it's important to keep in mind understanding what our role is and having a bigger vision for the work that we're doing and the context that we're working in. The story that I shared earlier about the Benedictine sisters who started working at healthcare in their community and then started asking questions about how does healthcare policy work in Texas, I think is a good one because the need out there is far too great for any one person, any one organization, any one sector to tackle on their own. It's really going to take the private sector, individuals, churches, nonprofit organizations, the public sector working together to be able to tackle the need. So the first dare that we have for Texas is to end hunger and food insecurity in our state. And to illustrate the point about the need being out there, being great enough for everyone to be involved in the solutions, this is some data that our colleagues at the Texas Food Bank Association, or Feeding Texas, shared with me. They track the pounds of food that charitable food donation covers in Texas. And in 2011, this is one of the heights of food insecurity and hunger that we saw in Texas, sort of post the recession. Food banks and charitable food, which covers most of charitable food giving in Texas, amounted to about 285 million pounds of food. That's an incredible amount of food being distributed through food banks and soup kitchens. In that same year, through the public sector, 4.8 billion pounds of food, the equivalent, were purchased through SNAP benefits. Now, that's not to say that what one sector is doing is more valuable than the other. Both are incredibly valuable, and there's no real substitute, especially for that direct relational connection people can make through service. But again, the need out there is great enough for all sectors to be working together and to be aware of each other in looking for solutions. The second big dare we have for Texas is around education. We dare Texas to fund public schools so that all students can really reach their potential. And there's a big opportunity here in Texas today. Because the state Supreme Court is reviewing the case, it's expected that they'll rule in the spring. And if they find that the state system that we currently have is unconstitutional and isn't adequate to meet the educational needs that we see in the state, the legislature will be meeting this summer to review our school funding system and see how we can solve this problem. This is a great opportunity for individuals, for churches, for organizations to get involved and tell their school board, talk to principals, tell their legislators that education really matters to them. It doesn't mean you have to be an expert in school finance. Almost no one in the state is, including many of the legislatures that have to work on this problem. But it is appropriate for individuals in the faith-based organizations to tell legislators that education matters to them, and it is something that they value and want our policymakers to address. Because ultimately, the decisions that that small group of legislators in the Capitol make affects how big our classrooms are, how many students each teacher has to be responsible for, how well we can pay our teachers, and the quality of teachers, and supporting the development and quality of our teachers, making sure that teachers stay within our schools instead of leaving for other occupations that perhaps are more lucrative or less challenging. So what happens in the state capitol really affects what we see going on in our schools from day to day. The next big dare we have is around the coverage gap. I shared what the coverage gap was a little bit earlier. We dare Texas to find a solution, close the coverage gap, as many other states have done, and provide those health insurance options for families in Texas. And the last dare that I have is a slightly more challenging one, but it's one that really is the foundation for all of the other policy changes we want to see in Texas, which is that in order to invest in the things that we say that we care about, like education, healthcare for the poor, Texas needs a strong budget to be able to invest in those things that we care about. With a weak budget, legislators don't have a lot of room to maneuver in making choices around how to solve the problems that we see in a very large and growing state. And I want to end here with this quote. This is from an essay that a colleague of mine at the Children's Defense Fund recommended to me this summer, and it's by John Powell, whose background is in law, but is a scholar who writes a lot about sort of the twin evils of both poverty and racism in our country. And he approaches poverty and racism from a very interesting lens. He approaches it from a lens of community and one of what he calls belongingness. He writes about poverty and races through a belongingness lens. And that's why I entitled my talk, Poverty in Texas, Who Belongs? And this is a quote from one of the papers that he wrote. And he says, "Those who stand outside the community have trouble making claims on it. It is not so much that they cannot speak as it is that they are not likely to be heard. That is what I define as poverty." And I love that quote. I just wanted to share that with you because you all are here interested and passionate about creating community in your churches, in your cities, and creating community wherever you are. And I think it's important to think about who belongs in our community, who in the back of our minds do we think of as not belonging in our community, and how is that related to who and how we are willing to serve. So I will end with that, and I think Jimmy said that we have time for some questions. And also if we have time, and if anyone did use their cards, I would love to hear if anyone wrote it on the Truth or Dare cards and would like to share.
Test, there we go. We have about 5 or 6 minutes, not very long. And I know if you can stick around at the break as well, Jennifer, I know there's some individuals that will have questions of you. 2 or 3 questions. What would you like to ask Jennifer? Raise your hand, I'll come your way, okay?
I'll even tell you how old I am. I know you've been wondering if you ask.
Hi, I'm Dave Smith, Executive Director of Good Shepherd Mission in Huntsville, Texas. Been there since March of '94. In '96, '97, Texas went through welfare reform, and I was on the advisory committee for Region 6, which is Houston all the way up to Walker County. Mm-hmm. When Lone Star Car was implemented, 70% of the people dropped off the rolls strictly due to fraud. In 2008, 9, that all changed, and a lot of those barriers were broken down, and now we are seeing probably about that much fraud again. That is significant fraud, and I have a problem with it because then those who really need it aren't getting it. We got to have some kind of contingencies for holding people accountable and integrity, and that's a big challenge here. Is there any solution to that, you see?
So the question was about sort of fraud in our public systems and also about welfare reform in particular. So I'll address those 2 questions separately. With welfare reform, it really did end welfare as we knew it in our state and all across the country. Currently, very few people receive any sort of cash benefits, TANF, in our state. Most of the money that the state receives in the TANF block grant actually does not go to cash benefits because the state has flexibility in how to use it. The state has chosen to use it for other types of training programs and other ways. And so if you look at the data for who receives TANF benefits in our state, it goes down and down every year and really doesn't exist as much of a program in the state or throughout much of the country anymore. When we look at, so the state and the federal government does do reports and research the issue of fraud in SNAP benefits, in Medicaid, in other programs. Because it is important to keep the integrity of the programs, they recognize it's in everyone's best interest, not only to keep people accountable, but for people to have confidence in the programs. And by and large, what they found, in SNAP in particular, is that fraud is SNAP has one in particular, has one of the very lowest fraud rates in Texas and anywhere. And also, another thing I think that's important to notice is when we talk about the issue of fraud in some of our programs, what a lot of people don't know is that most of the fraud does not actually take place on the individual side, it's from the providers. SNAP retailers or Medicaid providers are far more likely to be the ones trying to access money through the state government than individuals do. We, in Texas, for most of our programs, are very strict in the amount of time that you're able to spend on the programs, the work requirements that are attached to those programs, and the income eligibility. So that's, I hope that addresses some of the questions around fraud. But it is important to keep the integrity of the programs at stake.
Someone else. Oh, why would you have to be on the other side of the room?
Hi, my name is Kristen Bulgreen. I work at a food pantry in Belton, Texas. So my question is, the 2015 legislative session just ended, and there's not another one until 2017. So kind of what would be your charge to us in the interim? There are all these things we want our legislators to know about. We want them to do something about. How can we be strategic about this since we don't have another session until 2017?
Sure. So I'm guessing there's sort of a lot of different levels of experience in following the legislature and working with the legislature in this room. So for people who haven't had much experience with it in the past, just caring or knowing about the issues is a big step. Texas has very low levels of civic engagement in our communities, of people talking about issues with each other, people voting, which is really important. So just being involved in any way, it can be at the state level, it can be with your city government, and just learning about the issues, I think, is that first key piece. For people such as yourself who are maybe more working more in advocacy, I would connect with your state advocacy group. I don't know if you're connected with Feeding Texas at all. They would be a good guide, and they're sort of the connector for a lot of the state during the interim, and looking at how changes that were implemented or passed in the session, how they're being implemented now. And there's always a continuous cycle, as you said. The Lieutenant Governor has been starting to release the charges for the priorities that he would like to see the legislature study during the interim to look forward to the next session. But it really does come pretty quick, even though we only meet every 2 years. There is also a chance, like I mentioned earlier, that the legislature will actually meet again this summer, although they will be focusing, if that happens, they will be focusing primarily on school finance. For food, since you're interested in food and nutrition in particular, a couple of the issues that we're working on in the interim around hunger and nutrition in our state is very connected to schools and also churches and other programs. One of the big needs that we see one of the big programs that we're looking at during the interim is after-school meals programs. So after-school meals programs is quite an underutilized source of food in the state. What happens is, churches, Boys and Girls Clubs, YMCAs can serve meals and snacks to kids that come after school to them, and often who don't have a consistent source of meals for them at home. And there is a program, mostly federal money, but operated through the state that can help support programs who want financial support in helping keeping their programs going and providing snacks and meals to kids who come to their after-school programs. So, how easy that program is to operate, how much people know about it. We're doing a lot of work on sort of just getting the word out about some of these after-school meals programs. It's, again, underutilized and not that many organizations know about it. So if any of you run sort of an after-school program, I would look into that. I can connect you with our nutrition analyst who's been working with schools and churches on that issue in particular.
I want to make a statement and then a last question for you. Last year we did the conference here in Austin, and the very closing session was at the state capitol. And we were really blessed by two the congressmen who met with us individually, a Republican and a Democrat, and they told us how to advocate. What we find out is we don't do much advocating. And so what you have heard today is huge. These are the statistics of the stories of the people you know. And what I hope you heard is we've got to work together on some of these issues. There has to be effort where collective numbers, one of the first questions they ask when you come in to talk to our legislators, how many people are you representing? And as this network grows and as we understand the issues better, whether it be just writing a letter or if it means doing a campaign, we believe the years ahead for us, the brightest years ahead, are when we can collectively say the Texas Christian Community Development Network really is fighting for this issue, and this is what we believe. We're going to differ on a lot of issues, but there are some we just can't disagree on because they're so obvious. So I just want to remind you that a letter you write to a congressman really does make a difference. And yet because of our apathy toward government and the lack of voting that we do today, we've given up that in so many ways. So I thank you for the encouragement for that. And then lastly, what would you encourage us to do to stay on top of it? You've given us a great presentation today. We've learned a lot. We go back to our busy lives. What would you suggest we do to hook into the data that you're giving us after this time? And where else maybe should we be looking to stay informed?
Sure. So I actually have left some sign-up sheets out on the info table if you're interested in receiving email updates from the Center for Public Policy Priorities. We occasionally send out a newsletter on different policy issues going on in the state. We're a cross-issue organization, so we work in mental health, education, higher ed, a lot of different areas, and you can sort of choose what you're interested in there. And I would really encourage you to just stay informed and not be afraid to get involved. Legislators, school board members, city council members, they're just people who live in our communities just like us. They love hearing from people. And I think the faith community has a tremendous impact and opportunity and voice that's sorely lacking in our state. The areas where we have seen the faith community come in and we've worked in coalition with, we've worked with a number of Baptist and Catholic groups and the issues around payday lending, and there is a strong interfaith group that works on criminal justice issues in the state. Those areas, I think, have really been blessed with the involvement of people of faith getting involved in the process. So I think any more involvement from any number of you would just be incredible.